Hello, everybody. This is James, and it's a pleasure to have your attention today. Today, we're going to talk about carcinoid syndrome, which is a unique type of neuroendocrine tumor that goes beyond metastasis. While most cancers can spread to other parts of the body through invasion, neuroendocrine tumors have the added ability to produce biologically active agents such as serotonin. These substances can trigger a range of symptoms. So, not wasting much time, hit the subscribe button. I will be grateful, and let's get started. All right, so we're going to highlight on the biologically active agents that are produced by neuroendocrine tumors, which I would be referring to as NET. Well, NET is not a good thing because it does not only metastasize to the liver, but it also produces biologically active agents that is going to mess you up, that is going to make you blush, flush, wheeze, or even have an explosive diarrhea. Now, out of these substances, serotonins are the most commonly found substance which comes from mid-gut nets most of the time. But other active substances such as histamines, prostaglandins, and tachykinins are also released by some neuroendocrine tumor cells. Previously, well-differentiated neuroendocrine tumors were referred to as carcinoid tumors. So let's take a look at what happens. There is a bad tumor called NET, which produces, for example, excessive serotonin. Let's take a look at what happens normally. So serotonin goes into the liver, and the liver uses the process first pass effect. This is actually where the liver uses enzymatic pathways. The enzymatic pathways is used so that it will process the active substances coming into the liver, and the liver, by so doing, is able to reduce or decrease the active concentrations of the produced biological active agents. What is the purpose of this? Well, the liver does or uses the first pass effect to prevent excessive active substances from entering the systemic circulation. Now we have a situation where a tumor is producing excessive serotonin. The serotonin levels can actually become very overwhelming for the liver. But on top of that, in carcinoid tumors, there can actually be liver metastasis that can also lead to liver dysfunction. And this, of course, is going to create a situation whereby the first pass effect becomes inefficient so that more serotonins would enter the liver and it would escape the first pass effect. And so these substances are able to enter the systemic circulation because of liver metastasis. So it then makes sense that carcinoid tumors that actually originates from the GI tract may not cause symptoms unless the tumor has actually spread to the liver. Well, in summary, what we can say is that carcinoid syndrome is a group of symptoms caused by the release of different biologically active agents such as serotonin, histamine, prostaglandins, and tachykinins from a well-differentiated neuroendocrine tumor, which then leads to clinical symptoms. So majority of carcinoid tumors comes from the gastrointestinal tract, followed by the respiratory system. Rarely, the ovaries, kidneys, and testicles may also be involved. So normally only 1% of tryptophan is metabolized into serotonins, but in this case, the neuroendocrine tumor can actually redirect and metabolize as much as 70% of tryptophan into serotonin. This actually causes a low production of niacin, which is also known as pellagra preventing vitamin. So the absence of niacin leads to pellagra, as the name implies. Serotonin as well as prostaglandins also affects the gastrointestinal tract motility and secretions, hence this can cause diarrhea. Excessive serotonins can also affect cognition. In other words, we can see the 3Ds, that is dementia, dermatitis, and diarrhea. Clinical manifestations. So, as the symptoms can be very difficult to distinguish from other conditions, it is sometimes referred to as thin zebra due to its relative rarity and potential for misdiagnosis or even delayed diagnosis. Classically, this may be characterized by episodic flushing especially of the upper parts of the body, which may last from any time to about 30 minutes, which may also occur spontaneously or provoked by, say, drinking or eating or even during palpation of the abdomen. Pellagra may also be seen as a sign of niacin deficiency. Diarrhea may be watery and explosive but non-bloody with or without flushing. Bronchospasm may also prevail and mimic asthma, so patients may complain of wheezing, dyspnea with or without flushing. There may also be a cough and hemoptysis due to the hypervascularity of bronchial carcinoid tumors. Now, carcinoid heart disease may also present as a right heart failure, a tricuspid regurgitation, or an endocardial fibrosis, and a retroperitoneal fibrosis may also be seen. Now, a carcinoid crisis is an acute and a life-threatening event that may occur with advanced carcinoid tumors as a result of the release of huge amounts of biologically active substances such as serotonin. Now, during the crisis, the individual may experience severe symptoms such as flushing, hypotension, bronchospasm, cardiac arrhythmias, or even severe dehydration, which may lead to shock and organ failure. Supportive care such as oxygen therapy, fluid management, corticosteroids, and importantly, somatostatin analogs are very necessary in such cases. Bronchial carcinoids may grow slow, typically near the central regions of the lungs. They seldom release serotonin or its metabolite 5-HIAA. It instead discharges its active biogenic amine and peptides such as histamine directly into the systemic circulation, which possesses a vasodilatory effect and leads to pronounced symptoms such as atypical flushing or even sometimes pruritus. Diagnosis, biomarkers. So the initial test of choice is a 24-hour urine 5-hydroxyindole acetic acid, which is referred to as 5-HIAA. Chromogranin and platelet serotonin levels are also very sensitive and useful. Chromogranin A is usually much higher in mid-gut neuroendocrine tumors. Platelet serotonin levels may not be affected by food intake. Blood serotonin levels rather have a poor specificity. While in general, both 5-HIAA and chromogranin A may allow to assess treatment response. Alright, so let's recall that in neuroendocrine tumors, majority of the L-tryptophan is actually metabolized into 5-hydroxyindole acetic acid, which we will be referring to as 5-HIAA. This is an important metabolite which is actually excreted into the urine, hence this can be a very good initial marker when it comes to carcinoid syndrome. There is another fancy name for serotonin. This is 5-hydroxytryptamine. So what is the importance of these complex reactions that I put here? I want you to understand that if you enhance or if you inhibit any of the enzymes that helps in this reaction, this can certainly affect the levels of 5-HIAA when it comes to the diagnostics of carcinoid syndrome. So, an example, a patient is taking carbidopa prior to the test. Of course, this is not good in the sense that carbidopa is an inhibitor of L-amino acid decarboxylase. This means that a drug like carbidopa would underestimate or reduce the level of 5-HIAA in the urine. So this tells us it is very important to review all the drugs that the patient is taking prior to sending them for this laboratory analysis. It's also important to emphasize even the food that the patients are taking, in the sense that food that is rich in tryptophan can also affect the laboratory analysis. For example, banana, kiwi, eggplants, they contain a lot of tryptophan and can also cause an elevated or an overestimation of 5-HIAA levels. So, what are some of the imaging modalities for localizing neuroendocrine tumors? Well, I will also encourage you to watch one of my other videos titled Glucagonoma, where I explain the imaging modalities for neuroendocrine tumor, such as glucagonoma. So, a NET expresses somatostatin receptor on its surface. Hence, this can actually be targeted with PET scan and a gallium 68. CT scan and MRI are also very useful especially MRI, would be very informative when evaluating for liver metastasis. Somatostatin receptor scintigraphy, octreoscan, endoscopy plus a biopsy with a Ki-67 grading for cell proliferation would also be very important. An echocardiogram may be recommended in the evaluation of a carcinoid heart disease. Management. So, surgery is very crucial in the treatment of carcinoid syndrome, but important factors include whether liver lesions are resectable or not. In general, you would consider resection of primary tumor and reduce tumor burden by treating lymph nodes as well as liver metastasis. Radiofrequency ablation and a laser thermotherapy may also be tried if necessary. Somatostatin analogs such as lanreotide may also be used as NETs express somatostatin receptors on its surface. A peptide receptor radionuclide therapy can also be used, and a chemotherapy may be advocated when there is a poorly differentiated neuroendocrine tumors. In this case, everolimus may be tried. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.